Early in 1980, the HIV pandemic had begun, which would soon encompass the entire planet. For 3 years, no one had isolated the deadly pathogen until virologists in France and America gave it a name: HIV. Soon, many fled large cities, returning to homes not able to care for them. Soon, desperate people were faced with a fatal disease. Faced with this fatal disease, 3 gay men, determined to form a body to provide both medical care and housing for those with nowhere to go, created AIDS Project Greater Danbury. This all culminated in the basement of the Danbury VNA during the mid-80s. As this grassroots project developed, an office was opened and money was donated by local residents. Apartments were opened for critically ill clients in order to provide a safe space. Medical personnel constituted the active core as more and more cases arrived in the area. APGD continued to embrace more responsibilities, and a safe house was supported by state grants, as well as federal medical program funds. We expanded to collaborate with the city in order to provide a syringe service program and work to incorporate mental health and prevention services. The name change to Apex Community Care reflects the changing needs of our community and that we have done our best to adapt during times of severe need. To the many people who have donated their time and to the staff who provide special social services, this grassroots project has developed into a caring and embracing tree of protection. Dr. Donald Evans.
So, I guess I'll start out with, what does World AIDS Day mean to you?
It's a homecoming. It's a family reunion. That's what it is to me. It's a gathering of people who have a whole lot of underlying, how could I put this? I don't want to say symptom because it's not a symptom. We're not the disease. Camaraderie, I want to put.
Mm-hmm.
Doesn't fit to me, but camaraderie is going to have to do.
Mm-hmm.
It's also a place of changing knowledge, learning new things about medication, doctors, caregivers, other organizations that are working to keep this at bay. I'd like to be a part of that.
Mm-hmm.
I'm a AZT baby.
Mm.
I'm from the beginning. So I was a test tube baby. I tell myself, because I was testing everything they were coming up with. Try this, try that, try this. We got this cocktail, we got that.
Mm-hmm.
And it kind of broke my heart when they wanted to cut the funds for people who had me take that medication.
Right.
Because HIV was a plague to me. I had leprosy. Nobody wanted to talk to me, wanted to touch me. I'm on a friends list for life. I got to go through that every day still. The virus compared to this, there's no comparing to HIV.
Mm.
You know, today they would talk to you before they would even talk to you.
Mm-hmm.
Getting served off of paper plates, paper cups. People going behind me with bleach and stuff like that. You can't come in my house, you gotta wait outside. Things like that we don't deal with Corona.
It was New Year's Eve, 1996. This is the day when the letter arrived. You were denied insurance because you were HIV positive. I fell to the floor, handed the letter to my significant other. All he said was, "It must be a mistake. Get checked by a local doctor." I did. The doctor would not come near me nor touch me. He said he would only see me in a hospital so he could wear protective clothing and take protective measures. From that moment forward, my significant other would not touch me nor talk to me about HIV and our future. In 1996, when I was hired at a high school, their handbook stated that if a staff member was positive for HIV, they could be fired. It made me feel even more like a leper. I was devastated, alone, isolated, no one to talk to. I am now a leper and untouchable. Even a doctor would not see me in his office. I was so depressed, not because I thought I would die, but because I was now a leper. I started drinking heavily. My significant other did one great thing. Through his contacts, he arranged an appointment for me at the Moore Clinic, now Bartlett Clinic, at Johns Hopkins Hospital, Baltimore, Maryland. When I arrived there at that very first momentous day, the staff, Miss Blanche and Charlotte, were the very first people to make me feel human, worthy again. They hugged me and said everything will be fine. We will take care of you. We are all here to help you. It was the first time in 6 months that I was touched and talked to kindly. I cried and cried. I'm still a human being that can be touched. They weren't afraid of me. The clinic became my refuge, my lifeline. In spite of the fact that people were still dying of AIDS, even the patients were uplifting, kind, inspiring, giving out hope. Of course, we all hugged. I now find myself in need of support, encouragement, and help solving issues again. Somehow God guided me to Apex. Once again, I have been blessed with people who have given me the gifts of life and hope and support. I'm ever grateful and thankful for all these beautiful people who helped save my life. Anonymous.
Well, the first thing that comes to mind is all the spirits that I carry or that are behind me to keep fighting.
Mm-hmm.
And mind you, I've been fighting since 1989. I didn't pick this. My husband died in 1990. We never discussed it. He didn't know I was infected. I didn't know it was him that infected me. I had got diagnosed, was too ashamed to tell anyone. We were separated in December of that year. I was glad because I thought, my God, I have AIDS. How am I going to tell my husband? So we got separated, totally different reasons. So I said, okay, I can get up the nerve to tell him, and we'll work that out when we get back together.
Mm.
January of that year, I get a phone call from him. He was in Harvard Hospital.
Oh.
Okay, well, you know what? Ricky, I'll come up there. When I got to the hospital, my husband was like, boss, muscular, like huge. He was a big man.
Yeah.
First thing I thought, this is not my husband. He was maybe 100 pounds. Maybe.
Oh my God.
Long story short, funeral home, death certificate read, kidney failure due to AIDS. Barren light. That's how I got. 6 months after that, my AIDS complications came. Mind you, I was diagnosed with AIDS, not HIV. 6 months after his death, my complications began, and they went on for a solid 10 years.
Wow.
I was put into a AIDS hospice. I remember the family gathering, you know what, you might as well give up on this house. You're gonna die. I didn't know women didn't get AIDS.
Right.
I couldn't even figure out
Right.
how did I come to, I was married for 10 years. How did this happen? I didn't know anything. So I gave up my kids, not permanent custody, but I gave custody over to my mother. What I didn't know, she took my youngest daughter. My oldest daughter went to my sister-in-law.
Okay.
Never could get information. I went to Peter's Retreat, which was the only AIDS hospice in Connecticut.
Okay.
They were a 28-bed residence with a waiting list. I lived in the hospice for 5 years. Yes, it was a horrific time. Within those walls, I watched, over those 5 years, 30 people that I became close to. Usually dinner, we ate together in the dining room. We eat dinner, smoke a cigarette, go to bed, wake up, they die. I only had the staff and the resident. I remember saying to her, don't remember her name, am I going to die? Because at that point, I was losing my sight. Like, no, Alice, no. And, you know, she said it so quick. It was like, okay. You know, so I just telling my mother, Mom, everything hurts. My hair hurts. right down to everything hurt.
Yeah. Yeah.
Long story short, I got out, I left. But I never stopped going back.
Wow.
That was my family.
Yeah.
I had to go back.
Right.
One, to show them, listen, you will not die here. I was the executive secretary to the director of Connecticut Positive Action Coalition, CPAC, the very first consumer made, built from scratch wellness center.
I mean, so for you, what would you say to someone if they were sitting? So if I was someone who's newly diagnosed, what would you say to me? What would be the first thing that you'd want to say?
You know, I understand. You didn't see the horrors of the beginning, but I want to share some of them. You didn't see it, and bless God, you did not. It's a blessing, but you came into this situation. We can't change that now. You were infected, period, point blank. But let us pick up here. You will not go forward if you miss your medication, late with your medication, build a resistance to your medication. Let's talk about how you're going to build resistance. And once you do, you can't go back. You can't undo what you saw. So let's understand, everything is your choice. Everything. I made my choice when my doctor said, Alice, just get some of that gasoline in your stomach. Any of it. Some of it. Whatever you get in. I made that choice. I was best friends with people who chose not to take it. And I respect that. But they are no longer here.
So for Black heterosexual women, in my opinion, they get left out of the conversation almost entirely. Like everybody just overlooks them. So for you, what are some ways that you think we can kind of address the community in a culturally sensitive way, in a way that's actually going to make sense and resonate with Black women to help break down that stigma? Because you've lived that.
Right.
Yeah.
I would have to say, loving your husband means having the conversation. I was ignorant to that fact. I took that conversation away because I was just too scared.
Right.
And I absolutely understand if you are too afraid. If you're afraid to have it, if you're in danger, if you have it.
Right.
I get that. But let's start with you. Let's take care of you. We can work on getting you healthy, protecting you. Now, if we gotta work on your husband, because quite likely we're talking about a woman who is not, many women, we're not gonna walk out of a marriage. But I'm gonna talk real talk. Quite likely, your infection may have come from your husband. Mine did. And I would have never, ever believed it until I read the death certificate that said it. It said it. So there was my proof. I am just saying to you, don't wait for a death certificate to explain it. Get your help. And then maybe we can get him help. You're getting help. It's his way of getting help. You may stay him.
Right.
Getting your help, but at the very least, you're getting help. It's going to save your children.
Absolutely.
Can save you first, because then your children and women, it doesn't have any. It's gonna prolong your life so that you can do whatever your dreams are.
Mm-hmm.
You don't have to tell me, but when we have this conversation, ask yourself, what is it you want to do next? Whatever it is, give yourself an opportunity to do it. Because if you let this thing go on, it doesn't sleep. It doesn't sleep. So what? Ignore it and watch what happens.
Oh my
So I
gosh.
stand celebrating 60 with 13 grandchildren, one
Wow.
great grandson, and a grandchild on the way. Due date, my husband's birthday.
First of all, I would like to thank God for my many continued blessings, waking up every morning with the use of all my limbs, clothes, and in my right mind. This has been a very challenging year, full of a lot of uncertainty, darkness, and opposition. I have been dealing with a positive health issue for over 24 years now, and I've become reliant on the support and compassion from the staff at Apex. The level of respect, privacy, and peace they bring with their professionalism is something that keeps me afloat. There is not one situation that has risen where they weren't able to offer their assistance, and if they couldn't be a part of it, they pointed me in the right direction. Me and my boys are so very grateful and thankful to have had their support. I don't know where we would be sometimes if the team at Apex wasn't so caring and kind. They really love what they do, and I also love what they do. I'm very confident that I'm not the only client that feels this way, and as long as they are here to help, I will always have access to some of the world's finest group of people. I pledge my allegiance to the entire staff. I love you all. Thank you so much for your kindness. To God be the glory. Anonymous.
I think when I think about World AIDS Day, the first thing is it takes me back to the very beginning when we weren't even aware and when the pandemic really just began. And I remember how scary it was and how many friends I had and people I knew that were impacted. And it was very frightening. It was a death sentence if you were diagnosed with AIDS. And, you know, the history of this pandemic and the harm and the suffering that people experienced is the first thing I think of on World AIDS Day. It makes me want to be sure that we are all aware of not just where we are today, but where we've come from as a society in dealing with AIDS.
I've been HIV positive for the past 6 years. When I was told about my health condition, I couldn't process the information and I entered into a state of denial. I remember the doctor talking to me and I could barely respond to him. After leaving the doctor's office, I felt like my heart dropped and I couldn't hold my tears. I was ignorant regarding the topic and I didn't know what or how I was going to tell my boyfriend at the time. I was ashamed. I cried for hours and I didn't want to talk to anybody because I didn't want to get rejected because of my health condition. However, I knew I had the responsibility of telling my boyfriend what was happening because he had to get tested. After I cried myself out, I found the courage to call him and I told him I needed to talk to him, and so I drove to his house. He came down and sat in my car with me. He asked what was happening because he saw my eyes all red and swollen. I broke down in tears and I couldn't even look him in the eyes. I remember he said to me, "Whatever it is, I'll be here for you." That gave me the strength to tell him. He looked at me and said, "You are going to be fine and we will get through this together." That made me feel better and gave me some hope. The next day he went to see my doctor and got blood work. Thankfully, he tested negative. I was assigned to a group of people who have been great to me in the whole process. They made sure I understood what was happening, gave me all the information I needed, started me on medication, and got me professional help. I'm very thankful for my doctors, nurses, social workers, and everyone else that has helped me through this process and have stood by my side and continue to be there for me. I couldn't have done it without them. Anonymous.
So I was thinking about that. I really like that World AIDS Day is so close. It's right after Thanksgiving, because I kind of approach it with a sense of appreciation for how far HIV research has come. In the past years, AIDS Day has been kind of a renewed urgency to develop therapies that are more effective, less toxic. But, nowadays we're celebrating milestones like a recent study that found that there was a decrease in HIV-related deaths by half. So while we still have really far to go, I think that AIDS Day gives us a chance to really reflect and see how far we've come in such a short period of time. So what I've found, and especially as I'm kind of relating it to COVID, is right now the HIV epidemic, it feels smaller. And that's not just a reflection of the lower number of people that are getting infected with HIV, but it just feels more personal than it did in the past. Because, excuse me, there are agencies like Apex that are just so good at really embracing each client as a person and really honing in on their individual needs. And when I think how that's different to COVID, the COVID pandemic right now, it feels so large and unwieldy. There are really overwhelming rates of infection right now that I know for myself, I don't always have the time or the resources to really fully support each patient the way that I would like to. And the HIV epidemic now, it's not, there are 40 patients that I have to see. It's like, oh, great, I'm going to go see Bob today. I want to hear about, number one, how he's doing with his medication, but how work has been, how his kids are, things like that. It feels, that's what I mean. It feels smaller. It feels more personal.
And I think one of the things you're speaking to is how much case management feeds into the work that you do and kind of fills in the blanks, so to speak.
For me, World AIDS Day means a time of remembering where the fight against HIV and AIDS comes from and where it is today. Being someone who started working in this field not so long ago, it is very eye-opening to see the struggles that people have had in the past and where they are today and the amazing services that we have. Of course, there's always more improvement needed. So as case managers, as medical case managers, we help our clients navigate a system that can sometimes be very overwhelming when it comes to making sure they have access to their medications that tend to be rather expensive. And also we advocate for them when sometimes they don't feel like they have a voice. So we are there to support them and encourage them.
Embrace and enjoy the time you have right now. Right now. I mean, of course, if you're doing your medication, if you got medication, do the medication that they're talking about, man. You might not like it. I didn't like it. I didn't want to take. I don't like taking pills. But also, with the doctor, it's prescribed. So deal with it. And that's what actually happened for me. But I was incarcerated in 1987. 1987.
Okay.
And I actually had some type of job. I forgot what type of job. And we found out we didn't know about HIV. We just knew about AIDS because that's what we heard about. Yeah. And like I said, the type of job I had, and this one particular person had his own cell. Nobody could be around them. You can't be coughing around you. But they didn't even really want to find out what's the reason why. Because even if it's that one person, it can also be your mother, it could be your brother, it could be your sister, it could be your aunt, it could be your family member. So why would you look down on someone else? And also, you never know, that can be you, but then you want to omit it because you was denying it.
Right.
You know what I remember from the old days was that AIDS was AIDS, and we used to, it was AIDS. It wasn't HIV at the time, even though obviously we know the difference between getting the virus and having the diagnosis of AIDS. But for me, and I'm an old timer, and I'm not necessarily saying that this is right because we grow with time. Sure. But I just think that if we could just be kind of one a little more, you know. And I can't say I miss those days, but I do miss that oneness against the real enemy. I was looking at campaigns for condoms in the like 80s and 90s before I did this, and then I'm looking at campaigns for masks. Geez, they're using the same slogans, you know what I mean? You know, in the 80s we used to say, well, if this was a virus that you could get through the air, then people would not discriminate. I remember saying that. And if it was like that, then people wouldn't discriminate against you because you have it, or you had to do something nasty to get it, you know, because the sex and the whole, because people think of, gay men and sex, that's what they think, you know what I mean? And even though heterosexuals have more anal sex and, but people don't think that way, you know what I mean? Or oral sex and all that other stuff. And we used to think, well, if this was transmitted like TB, for example, people would not be discriminating, people wouldn't have any issues against it. And here, this is COVID. You really just have to be around like the air and there's COVID,
Right.
And the controversy that, has brought up, it's just a shame. I thought AIDS had taught us a lot of lessons, and I know to some extent it has. I mean, but AIDS started all this stuff, and AIDS, I thought, had a lot of lessons, PPE and all that other stuff. And here's the government just in the same boat that it was with HIV. I mean, it's just the same. I'm very disappointed. I'm really disappointed. That I thought it was important to sort of remind people that, what we're doing today is not that much different than we used to do. And to be quite honest, HIV, the virus itself, is just as lethal as it was when we first discovered it in the 80s.
Absolutely.
It can kill you just the same. We just happen to have really good tools, but if we don't use them, if we don't use someone like you, if the word doesn't get out, if this doesn't exist, somebody can just die the same horrific death, and somebody dies the same horrific death.
Absolutely.
The thing is, now it's like, okay, PrEP, well, it's for, gay men. Well, no, it's actually not. It's, and women, it's like, well, I never heard of it, and I didn't know it was for me. My doctor never told me about it. And then somebody else tells another story about PrEP. And before you know it, it's like, really? Like, it's because we're just so segregated to some extent. Like if you have a gay men's group, PrEP will come up. And a women's group, quite frankly, it doesn't come up. I know, I'm part of it, and so it's like all these tools that we have, and instead of making a toolbox and giving the same toolbox to everybody, and then people choosing the tools that are good for their lives, is like, oh well, this tool is for this one, and it gets segregated to different groups. And it's like, no, HIV is still what we're fighting.
I've been on PrEP for about a year now. Prior to being on it, I had been trying to get my primary physician to give me a script for it. He refused to for a little until I went in with some information I got from online. He read it and finally agreed to give it to me. Ever since then, I've had no side effects and I've been taking it as prescribed. I definitely feel more secure taking it, and I'm even more glad that there's a generic brand so it's more affordable for people. Anonymous.
It's time to step up, prep up.
Step up, prep up.
To help keep you free from the risk of HIV.
From the makers of Truvada, a new PrEP option, Descovy for PrEP, a once-daily prescription medicine that helps lower the chances of getting HIV through sex. It's not for everyone. Descovy for PrEP has not been studied in people assigned female at birth. Talk to your doctor to find out if it's right for you.
Step up for health and body.
Prep up for your one and only love, or many loves. For kings, this queen, and you royals in between. For my now.
Our now.
And my future.
Our future.
Step up, prep up.
Descovy is the newest way to PrEP. Descovy does not prevent other sexually transmitted infections, so it's important to use safer sex practices and get tested regularly. You must be HIV negative to take Descovy for PrEP, so you need to get tested for HIV immediately before and at least every 3 months while taking it. If you think you were exposed to HIV or have flu-like symptoms, tell your doctor right away. They may check to confirm you are still HIV negative. Serious side effects can occur, including kidney problems and kidney failure. Rare life-threatening side effects include a buildup of lactic acid and liver problems. The most common side effect was diarrhea. Tell your doctor about all the medicines and supplements you take, or if you have kidney or liver problems, including hepatitis. If you have hepatitis B, do not stop taking Descovy without talking to your doctor. Ask your doctor about your risk of HIV, and if Descovy for PrEP is right for you.
Words are loud, but actions are louder.
Step up,
prep up
with Descovy for PrEP.
Get help paying for Descovy for PrEP. Learn more at stepupprepup.com.
So to help combat the HIV and AIDS, epidemic, in 2019, I joined Jeff Curry, who was another legislator, to introduce a bill that would allow minors to have access to PrEP without parental consent. And we know how that's important, especially in today where, some parents don't like to believe that kids are having sex or teenagers are having sex, and we know that they do. And also it is important that, the stigma around, kids who do need to be on PrEP, which obviously is a preventative drug for contracting HIV. And so we know that communities of color are often impacted by that as well. And so this bill basically allowed kids to just have the privacy to go to the doctor and ask for, this important drug and life-saving drug without parental consent, because we do know that, sometimes parents don't understand. And, the stigma too around LGBTQ kids who are afraid to come out and afraid to seek the help and advice they need from a medical doctor who would ask them, are you sexually active? Especially if you're gay, they would recommend probably someone being on that. And so you're kind of missing those conversations if people can't be open and truthful with their medical provider. So I just think it's educating people about how come HIV is still here and prevalent and why it's still spreading and why it's affecting certain communities. And I think people need to understand that, they don't know who their partner is sleeping with. And, sometimes, there's still a stigma about being gay, and there's certain communities that aren't okay with that. And so some people are having sex with men, and sometimes it tends to be men of color having sex with other men of color or other men in general, and they get this disease and they go back and, they have a girlfriend and they sleep with them, and some, that's how it spreads. And so I think people sometimes like to just think that, no, only that community has it and staying in that community, and that's not true. And it's kind of crazy that we're still fighting that stigma from the 80s today. And, I was with you maybe a couple of months ago, and, I got tested for HIV, and we, videoed it and we put it on social media. And like, I know some straight friends like saw it, and like, they were joking. They're like, oh, like someone saw it, and they're like, oh my gosh, like Raheb's like getting tested, like, does he think he has this or whatever? And, I was like, no, it's about awareness, and like, I was like, you should be getting tested as well. Have you ever been tested? And like, they're like, no. And I'm like, when you get annually tested, you should ask for that as part of it. And, then it's like, it leads into the conversation of, me being able to tell them why they should get tested. And, I think you have to turn it about, how's it about them, because I think that's how we kind of get to people, by just bringing it back to them, and not to scare them, but, you don't know, like we said too, with the pandemic, people are not really going out or, getting the services that they need, because actually, they're also exposing themselves to that. So, a lot of people are not getting tested, and they should be. And we have home kits where people can use them and get them. And so it's important that people know how easy it is to get tested.
Yeah, so there are a couple of reasons why it's important to get tested. First, so that way you know your status and you can make the proper precautions with your partners, and you can have that conversation with your partner. Another reason why it's really important is because when you come in to get tested, one of us will be counseling you, and you can open up those conversations about what could exactly be putting you at risk for HIV. So whether that be injecting drug use and understanding about the importance of using clean needles, or different ways that you can practice safe sex, whether that be through using condoms, lubricant, or getting creative around ways that you can have safe sex if using condoms or traditional forms of protection don't work for you. An example of a creative way that we've been telling clients is about having a closed circle of people that you are sexually active with, and kind of making like that ethical pact that you are going to be active with this group of people, you're all going to get tested regularly, and no one is going to be active outside of that circle, so that way you can have that peace of mind. And then so the way that testing happens here at Apex is we offer the rapid antibody test that takes around 20 minutes. And so one important thing to know is that with our test, the HIV antibodies cannot be detected within 90 days, so it takes 90 days to show up on the test. So we go over all of that with you when you come to get tested. And it's just a simple finger prick right on your finger. We just collect a small amount of blood, and within 20 minutes you'll have your results and be on your way.
Yep. And we also have the option because of COVID, and we're trying to make sure that people still have an increased access to resources. If you don't feel comfortable coming into the office, or you know that you've had an exposure to COVID and maybe quarantined, but also need an HIV test, we offer take-home tests, and we will send them out to you to where you live, or you have the ability to come pick them up. And then when you're home, you can get on the phone with us and we'll help walk you through the process of that take-home test. And it's not a blood draw test like we do in office. It is a oral swab test. So U equals U means undetectable equals untransmissible. That is a tongue twister. So in that respect, essentially, it means that if you are taking your medications every day and going and getting blood work regularly, your viral load will go down to the point where it's undetectable. And when they can't see the viral load there, that means that you are also untransmissible. So you can't transmit the virus to someone else. And as we've also learned, it's also treatment as prevention. So it's a way of being able to get to zero. More people are able to stick with their treatment, stay on treatment for a long time, bring that viral load down, get to the point where they are U equals U. That helps prevent transmission.
Messaging.
It breaks down the stigma that people who have HIV aren't like everybody else, or that they are contagious and can spread the virus. Everybody who has access to medical care and access to medication, especially here at Apex, we're working towards that U equals U, because we want everybody to be able to have a normal life, live normally, live happily, live healthily, and that helps destigmatize that whole idea that they can't have that normal life. They can, they do, they are. The disease doesn't define them, and if you're on medication, you can have a happy relationship with other people and be able to be safe and not transmit the virus to others.
Me, myself, and I are a team. On some days, Joanne Mooning is 55 years young, a mother of 3 sons, good-looking sons, a grandma, auntie, sister, friend, too many to count. Hopefully, I will, I must, and still I rise. I am still standing. These words remind myself every day to pick me up. I have lived through abuse, molestations, and drug abuse. Yes, those moments I like to call my crazy, I need to do all I can do to survive just one more day. Years, I'm going to kill somebody, going to jail for murder. Years, I am so messed up, I don't know what to do. Years, I am pregnant, mother at 21, 23, and 24. I am not married though. I am okay with that now. Then, not so much. I'd ask myself often, which way do I go? AKA angry black woman years, days, nights, and weekends too at times. What nightmare is this? In 1998, I tested positive. Trust me, you would hate that phone call too, for sure. To add fuel to the fire, I found out I had bipolar disorder 1, 2, and PTSD. Hot mess years. Which way am I going? Which way do I go? Years. Is it me or others acting funny and phony? More them than me? Some people can be so rude when they do not understand something. I don't mind if it's only me it affects, but not my sons. So I started staying home a lot, finding other outlets, avoiding men, drugs, alcohol, and other people's homes. I knew I needed time to learn about myself, HIV, and teach my family and friends about it. The only problem was I quickly learned how to maintain my HIV, but over the years, the information and the methods changed. The medications started to get expensive and my insurance wouldn't cover it. Nearly after, I lost my job, so it was impossible for me to maintain it. These were the angry black woman years too. That was until Apex came to the rescue. They paid for my medications, bills, and they supported me for Christmas presents. For a while, I didn't know which way to go. I did it all, including programs to make sure I lived to watch my sons grow up, and I found my purpose to live on. It came with a smile every day. Yes, I will shout to the moon, the stars, and the world. This HIV is not going to bring me down. Years. A child is born to learn, love, and be loved. I hope I have loved each one I came across. I hope they have learned how to love back. If so, then I have done more good than bad. I am still a child learning to love and be loved. Family and friends are a big part of healing and acceptance when dealing with HIV and mental illness. These are the grateful, love yourself first, second, and third years. 22 years being HIV positive, and I'm still standing. I've been bumped and bruised during this journey. I thank God for every day that I have. Me, myself, and I are a team. Most of the time. Thank you. Joanne Mooning.
As you may have heard, Apex promised a big announcement today in conjunction with Giving Tuesday. In an effort to expand and consolidate our current services in the greater Danbury community, Apex Community Care recently purchased a building at 16 Hospital Avenue. This plan allows Apex to implement an exciting vision to add to our service array the highest quality medical care created with and for communities of color, LGBTQ folks, immigrants, low-income individuals, and, of course, those with HIV. Existing services which are bursting at the seams in our current 3 Danbury locations will be relocated to 16 Hospital Avenue. In the new building, Apex will continue to provide all of our current services. Apex believes everyone deserves access to high-quality, compassionate health care that's appropriate for their needs and concerns, no matter their gender identity, sexual orientation, immigration status, or financial situation. Apex's plan is to provide sensitive and comprehensive primary care targeted to meet the health needs of all of our present and future patients. The new location will continue to offer the welcoming, supportive, and safe environment which Apex clients have come to expect. We will also be adding an LGBTQ drop-in center to provide a safe place for the queer community to gather and receive support. Apex's concept for the building calls for extensive renovations to the 20,000 square foot existing space. To accomplish these goals, the leadership team, board, and staff of Apex are seeking to raise $250,000 in private and public funds. The successful completion of this campaign will secure Apex's vision, and your part in it, to provide health care with dignity, equity, and cultural humility through inclusion and empowerment. We are asking for the support of new friends and longtime donors alike to make this new vision for Apex a reality. Donations of any size are appreciated. All contributions will be acknowledged in our annual report and capital campaign donor lists. Contributions of at least $100 will also have their name on a recognition wall. There are also naming opportunities for gifts of $7,500 or more, including the treatment rooms, LGBTQ drop-in center, comfort room, and group room. To make a donation, please go to our website, apexcc.org. To find out more about how we might partner with you to meet your philanthropic goals or for naming opportunities, please call our main number at 203-778-2437 and ask for Jill.
And I want to leave you guys with this. A poem by Anthony Bay Carter. That's me. This is to the caregivers. City under siege. My brothers and sisters, heed these words of power, lust, and greed. For they are the driving forces in this city under siege. People are preaching in the streets, stop the violence is their plea. But just around the corner, someone's dying senselessly. The population dwindles, death is very realistic. And if we take the time to read the print, that's fine. 98% black says statistics. Our kids can break down the Uzi, put it together again, yet more than half of them can't read. And that's just a small clue of what's in store for you in this city under siege. Someone ends up in jail for selling drugs until their friends, they'll brag about it, saying, I'll be out on early release because the prisons are overcrowded. That's a conditioned mind, a conditioned world, a condition that we don't need, that we don't try to shake it, we just sit back and take it from the city under siege. But there is one thing that we've got going for us, and it's the one thing that we need. And that's to know it's never too late with his help to escape this city under siege. Thanks for listening. Beatnik.